Hi there everyone. Welcome to this week's video where we're going to talk about the Hippocratic Oath and biomedical ethics. I'm going to keep this video somewhat short because I'm going to ask you to listen to a BBC podcast that's a little bit long for this week, but our main goal for this video is to explain some of the basics behind the interest in the Hippocratic Oath in the realm of biomedical ethics. Up to this point, we've discussed two main moral theories, namely consequentialism and deontology. These are moral theories for describing general moral obligations that you have towards anyone and everyone around you, right? Neither the utilitarian or consequentialist account nor the deontological account say anything about special kinds of relationships that people come to adopt for one another through various social roles. So part of what biomedical ethics is concerned with will, of course, be relevant or involve this sort of more general treatment of ethical principles, but much of it concerns the very specific and special obligations that doctors have towards their patients and perhaps also towards one another. So if general obligations are those obligations you have towards anyone and everyone, then special obligations are obligations that you have towards a particular person in virtue of your adoption of a certain kind of social role. So, for example, parents have special obligations to their own children. They are charged with their child's well-being. Right? Whereas they do not have the same degree of ethical and legal responsibility to any child on the street. Similarly, it's an important topic in biomedical ethics that doctors and medical caretakers have obligations towards their patients, that their patients are entering into a special kind of relationship with the doctor, that there are especially important moral reasons not to violate. And so the Hippocratic Oath is a really interesting document because it's probably the first professional ethics statement in all of human history, or at least to the best of my knowledge, at least in Western history. It's the first known and widely popular professional ethics statement. And it's a notable fact that up to the current day, we continue to invoke the Hippocratic Oath, both in the process when you graduate from medical school, you are often asked to perform the Hippocratic Oath. The Hippocratic Oath is also consulted by judges when making law regarding healthcare and so on, right? And so the Hippocratic Oath continues to be important as a description of the obligations that doctors have towards their patients today. Now, to begin with, the Hippocratic Oath is said to be written by this ancient Greek guy, Hippocrates, Hippocrates was a really famous doctor around the same time period as Plato and Aristotle in ancient Greek. He actually comes up in both Plato and Aristotle's writings and is cited as this sort of figure of a great doctor. Now, one thing that's really difficult about learning anything about the ancient Greeks is that they didn't have the same conventions that we do now whenever we publish professional writing, right? We write our name, we take it to be important not to plagiarize, right? Authorial intent and venue of publication and so on are really important archival features of documents for us, right? But not so for the ancient Greeks. The ancient Greeks often didn't, write their name as an author on books that they produced. That introduced a great deal of confusion about the authorship of a number of works. And it was also a very common practice in the ancient Greek world to practice writing by, for example, trying to write your own version of a Platonic dialogue. This was seen as sort of, an writing exercise, but also as a kind of rite of passage. So that really muddies the waters quite a lot. There's a whole treasure trove of documents that are all attributed to Hippocrates, but we can't really be certain about whether any of these documents were actually authorized by him or if they were written instead by a student, right? And it's unclear to what degree the student's ideas could be attributed to Hippocrates or not. One way that we know that there are at least some illicit sources that are part of Hippocrates' corpus is that they contradict each other, right? They often will describe, for example, their theory of the body and so on differently. But to further contextualize the document, and I'm paraphrasing a really nice contribution by one of the classicists in the podcast that I'm going to have you listen to, is that the Hippocratic Oath is kind of halfway an apprenticeship document and halfway a religious oath. Right? So if you read the Tyson article and you look at the old version of the Hippocratic Oath, it references various Greek gods, right? Asclepius, the god of healing, as well as various others. And it's also an apprenticeship document in that, like as is tradition in medical schools today, you would take this oath upon entering into the medical profession, right? This was sort of the condition for you to be initiated into medicine, doctoring during this time, is that you agree with these basic principles and you will commit to continuing to, propagate them into the future. Now, the religious aspect of it is, of course, that you are cursing yourself, as it were, right? You're saying, I must do these things, I must follow these precepts, and if I don't, then, I will not be blessed by the gods, and in fact, I will incur their ire, and, all of this sort of thing, right? Now, as different as the context of ancient Greek the ancient Greek, original version of this document is, we can nevertheless note that it's quite interesting that, in spite of the fact that it's an apprenticeship contract and a religious oath, that it's also a professional ethics statement, right? It's making it important, even largely, I think nowadays we would regard as true claims as to what doctors owe their patients and what doctors also owe to each other. So while the context of how it, came about and was perpetuated and so on in the ancient Greek world is somewhat unclear to us, we can know that since its original inception in the ancient Greek world, that the Hippocratic Oath has been enormously influential within Western doctoring. Also, relatedly, there are sort of waves of the usage of the Hippocratic Oath, right? One thing that the Tyson article points out is that around the early 20th century, the use of the Hippocratic Oath was relatively low. But nowadays, for example, it's relatively high. And the adoption or lack thereof of the Hippocratic Oath is not directly correlated with good or bad doctoring. So, for example, Nazi doctors were really, really into the Hippocratic Oath, right? And I don't think anyone would say that they acted in a moral manner, right? So it's obvious that a commitment to the Hippocratic Oath is on its own not enough to ensure moral practices. Tyson, therefore, raises some worries about the Hippocratic Oath, namely whether or not it's meaningless, right? We don't believe in this sort of ancient Greek god cursing thing, right? And while obviously medical malpractice is a crime and there are various legal apparatuses to deal with that, the Hippocratic Oath is itself not a binding document, right? So no one can enforce the Hippocratic Oath upon you, which really raises the question of whether taking the Hippocratic Oath for Tyson is a meaningful act anymore, right? So, like, almost everyone takes the Hippocratic Oath that goes into medicine. However, there's enormous amounts of disagreement about what the Hippocratic Oath is taken to say, and it's gone through various versions over the years that will take some parts and leave some others, and all of this kind of stuff, which to Tyson further raises the question of its meaningfulness. And one way to bring that out is that most of what the Hippocratic Oath says can be given either a consequentialist or a deontological interpretation, right? So it's really ambiguous. Like, we don't even know what kind of moral reasoning the document is using. I mean, it's really quite short. It's like 300 words, right? And so just to give you a couple of examples of this, the Hippocratic Oath is often read as prohibiting euthanasia. Euthanasia is a topic that we're going to discuss in much more detail later on in the semester, but eu means good, thanasia means like death, right? So a good death, right? We, in a modern context, think about euthanasia as a medical practice that takes place when a doctor compassionately ends the life of their patient who is suffering from a terminal illness. And so one way to read the Hippocratic Oath is a deontological statement as saying there's a duty not to harm, euthanasia violates this duty not to harm, and therefore, there's a moral obligation against doctors providing euthanasia, right? But it's also possible to give an entirely consequentialist interpretation of euthanasia, which is that giving out things like poisons to people, right, will cause civic havoc, right? So it was not only the case that doctors, for example, would administer poisons, but sometimes, for example, people would try to buy poisons from doctors, right? And so another way of reading this injunction not to sell or distribute drugs that can lead to people's death is a sort of anti-poisoning regulation, right? Similarly, the original version of the Hippocratic Oath also appears at first glance to declare a moral prohibition on abortion, right? It inveighs that it's not appropriate for doctors to provide abortions, right? The most straightforward interpretation of this is, again, a deontological interpretation according to which doctors have a duty not to harm. Abortion is a mode of harming someone, and therefore doctors have a special obligation not to be involved with abortions. However, things become a lot more ambiguous when you recognize that, at least in a lot of writings that are attributed to Hippocrates and were common practice at the time, there were all sorts of abortions that would take place in the ancient Greek world, especially before 3 months, right? So it's really ultimately not very likely that Hippocrates is sort of speaking in a contemporary Republican vein, saying that life begins at conception and that we have a moral obligation not to hurt the fetus or the unborn child or what have you. Instead, it's quite likely that he has a different, distinctive understanding about what kinds of abortion practices are morally justifiable and which ones aren't. And that seems a lot more like a consequentialist point of view. Similarly, the Hippocratic Oath also prohibits surgery, right? It prohibits the doctor to use the knife, right? Once again, easiest interpretation is deontological. There's a duty not to harm. Surgery has a good chance of harming people, especially back in those days before they had any notion of hygiene and so on, right? It was a very gruesome affair. And so surgery for doctors is prohibited. However, once again, if you look at other Hippocrates' writings, you'll see that Hippocrates wrote about surgery, right? And so it doesn't seem very likely that this is something like an absolute prohibition on all kinds of surgery. Others have interpreted this text as saying that doctors, physicians, should sort of pass off surgery to specialists in surgery, right? And that's in some ways very close to modern practice, right? You wouldn't have like an ordinary primary care physician, right, doing surgery on people. So the plethora of all these different interpretations and the fact that we're so willing to change the Hippocratic Oath in various ways raises for Tyson the question of whether the Hippocratic Oath is meaningful nowadays, right? If we can't agree on what it means and there's no enforcement mechanism for it, right? Tyson wonders, what is its moral importance? But more than I want to know what Tyson thinks, I want to know what you think. Do you think that there's a correct interpretation of the Hippocratic Oath? Does it read more consequentialist or deontological or something else? Do you think that the Hippocratic Oath is important even as stating just overall general principles? Why or why not? I very much look forward to hearing what you think and to seeing you in the next video, where we're going to start talking about specific practices in biomedical ethics.